Good afternoon. This is George Latimer, Westchester County Executive, and today is Monday, December 28th. We'll be providing updated information on the Westchester coronavirus outbreak, which is now completing its 10th month as we head into the new year and getting ready for a New Year's celebration and hopefully with a vaccine available to us. Our numbers that were provided today from the New York State Tracker show that there are 67,388 positive cases since the beginning of the pandemic. And when we compared against the number of positives we had 2 weeks ago, 59,431, that means a total of active cases of 7,957 active cases of COVID as of today in Westchester County. Now, that number is a bit encouraging. It's down 200 active cases from a week ago, and it's down almost 800 cases 2 weeks ago. That does mean that the testing positives over the 2 prior weeks were much greater than what we've had over the last week. So there's been a diminution in active cases, which is encouraging. We hit a peak of 8,700 active cases, 8,771 to be specific, mid-month on Tuesday, December 15th. And so now as we get ready to close out the month, we've dropped down a little bit, about 10% down from our peak. However, the other numbers aren't quite as encouraging. Our hospitalization numbers continue to rise slightly. We were flat for the better part of a week to 10 days, but now we've seen some rise in the last few days. Our most recent hospitalization number is as of Saturday, December 26th, where 392 people were hospitalized with COVID. That number compares to 353 people the week before. So in the week that ended on Saturday, we had 40 net additional people hospitalized for COVID. Now, as a percentage of all the people that have an active case of COVID, not anybody who's ever gotten it, but of the people whose cases are active right now, that 300 number, that 392 number, represents slightly under 5% of all the people hospitalized. As a percentage, that is a good number. The less we have hospitalized, the better we are. We get very worried when the hospitalization number gets up into the double digits. The high double digits approaches 20%. That becomes problematic. And we've mentioned that we have somewhere in the vicinity, I'll use a general number, it seems to be shifting a little bit, of 2,500 hospital beds in Westchester County. If we have them all available to us, there are other individuals who are hospitalized for other reasons. But at 2,500 available beds in the county, to have not quite 400 people hospitalized for COVID does give us the ability to maneuver within whatever might be the increasing numbers in the pandemic. But going back to the hospitalization numbers, excuse me, while we have 392 as of the most recent number, and it jumped up 40, the percentage has still been about 4% hospitalization numbers. So that is a good sign. I don't know, not being a scientist, if it means anything about the disease itself or the strain or our natural antibodies, but the less people that catch the disease, the better it is. The less people who have the disease and are hospitalized, the better it is. And then, of course, the least number of people that we lose to the disease is the best statistic of all. That number has been rising. It is not a good number. We've lost 1,652 people as of today to COVID disease. That's 41 in the last week. And the week prior to that, we lost 43 people. We started to see a more significant uptick in fatalities going back to the week just before Thanksgiving. If you go back to the 23rd of November, slightly over a month ago, we had lost 15 people in a week. That number in weekly intervals went from 15 in a week to 19 in a week, 34 in a week, 43 in a week, now just slightly down to 41 in a week, but still a similar type number. And those numbers have risen us from 1,500 now up to 1,650, which is an increase of 10% over where we were at that time in November. That may represent the Thanksgiving spike. We can't be 100% sure of it, but certainly people at the Thanksgiving holidays met with family members. Was discouraged to do it or to do it very judiciously, but we've certainly seen a spike. And now that the Christmas is a couple of days behind us, we are concerned and worried that we might see another spike over the next 10 days to 2 weeks. That would represent the incubation time for people who were with family members over the Christmas holidays. But nonetheless, the numbers are what they are. A slight decrease in total number of active cases, increase in the number of hospitalizations, increase in the number of deaths. And all of those factors are important when trying to assess where are we in terms of the pandemic itself. The numbers that we receive, that we report on, do come from the New York State Department of Health tracker. and we now have our own dashboard that is up, which is accessible for you to look at all the time. We don't need to now send out maps that give some information. We have slightly bit more information. It's available on the dashboard. There's a link to it that is easily found. We'll put it out again on our Facebook page for those of you who are watching this currently, and you can go in and take a look. Now, we did have some glitches in numbers, and so as of Christmas Eve, which was December 24th, 4 days ago, we froze the website until we were sure, the database dashboard, until we were sure that we had the right information coming in. And so it's been reactivated fully today. If you went a couple of days, you didn't see the numbers, please be understanding. You know, we don't do this for a living. We're trying to respond to data information as requested. And we're still trying to lobby to get information that breaks down the data that I report on a countywide basis into a municipal setting. Both hospitalizations and deaths, we know that many people want to know how many people in their community have the disease or in another community have the disease, are hospitalized to the disease, which indicates a certain degree of severity, and then the number of people that have passed away. So we think we've made a major improvement. We want to thank the players that have been involved in that. I think I credited them the last time we spoke, from IT and emergency services. Susan Spears has been our point person working through these things. But the bottom line is that we're trying very hard to give you this information now. You can go in and look at it at any point in time and get what information there is there in a timely fashion. Gives you a little more of a breakdown than the state tracker does. And as soon as we have additional information, we will certainly share it with you. Again, I think we've made a good step forward with the dashboard. It does track positive cases, new, cumulative, and active cases, and you'll see the year-to-date statistics sync with what we see in the state tracker. And, of course, you can now check it any time of the day or night. So all of those things are improvements over the system that we had in place before. And, again, I'm grateful that we've been able to do that. One of the COVID-related impacts we're having now is with our Beeline bus system. A number of our buses are missing trips every day on fixed route bus service because we have a COVID-related bus operators shortage. That means that people who are the trained bus drivers for the Beeline bus system are coming down with COVID. They have to go through the same quarantine and isolation policy that any of us do, and it leaves us with insufficient number of bus drivers to run the routes as is available. We don't know that information in advance. Bus drivers will report, as anybody would, in sick on a given day, and when it's COVID-related, that reporting in sick triggers a 2-week period of time very often. It is frustrating, and I know that passengers complain because they don't have the same trips that they're expecting to have and accustomed to have. We have no way of anticipating it the night before where we're able to send out a message. A person who is sick calls in sick that day, and then we are undermanned for the number of buses that we have on that particular day. Liberty Lines is working on an operations plan that we hope will provide somewhat greater notice, and they've added an extra office supervisor to help coordinate and communicate the missed trips. There's road supervisors, driver training staff members have also been reassigned to actually operate buses. Those are the staff people who have graduated from being bus drivers at some point and still can handle the vehicles. There are a hope that some of the vacations will be able to be adjusted beginning the new year. That will allow for us to keep these things open. We really do apologize for the inconvenience. We know that it is a source of complaints, but it's also something we are trying to deal with now with Liberty Lines, which is our public-private partner in providing the bus information, the bus service that we have right now, and that is important to everyone. I want to highlight also, we've touched on this before, but our Department of Consumer Protection under the able leadership of Jim Maisano has really put out some very important information to deal with scams that are out there, vaccine scams. We have a video that we'd like to show you. It is in English, and it will give you a little bit of an idea of what we're trying to address and alert the public to avoid if they get a phone call, unwanted communications, promising some benefit from vaccines. Here's the video now.
We're starting to see vaccine scams across the country. It's the typical scammers and hackers using their typical tricks where they try to steal money from you and to steal your identity. And now they're doing it through the vaccine scam. It's very important for consumers to be aware that the vaccine is free. So if someone calls you to ask you to pay to get the vaccine, that's a scam every time. If they say that you can pay to get the vaccine earlier, that's a lie. That's a scam every time. If they say they can get you on some kind of waiting list, that's a scam. Consumers are not going to get phone calls from Social Security or Medicare or any other government agency about getting the vaccine. So if you get those kinds of calls, you immediately view them as a scam. But most importantly, do not give out your Social Security number, your bank account information, or your credit card information. Delete the text, delete the email, hang up the phone, or slam the door in their face. And if you do get contacted by one of these vaccine scammers, please call the Westchester County Consumer Protection Department at 914-995-2155.
And the video that you've just watched will also be issued in the next few days in Spanish as well, for those who are Spanish speakers or is their most comfortable language of communication. The county's Department of Consumer Protection is really telling everybody, all of our residents, to be on the lookout for COVID-19 vaccine scams, because as we enter the next phase of the pandemic, people will be waiting to find out when can they get their shot. They'll be anxious. And it's out of that desire and anxiousness that people will promise them to deliver something that they may absolutely be unable to do. The distribution of the vaccine is attempted to be very structured around certain priorities. We've already heard that the first round of vaccinations went to hospital workers and was channeled through local hospitals. The second round going to nursing homes and nursing home staff, both residents and the staff of nursing homes. Those have been coordinated through CVS and Walgreens, two of our large chain pharmacies. And then Westchester Medical Center has been tasked with putting together and administering a plan for the next round after that of people who are going to be vaccinated. And their task is not just for Westchester, but for the 7-county Lower Hudson region that goes all the way up to Sullivan County, Dutchess, Ulster County as well. So there is a protocol by which people will be able to get the vaccine, but it's not everybody all at once. It's not based on how much money you have. It's not based on your political power. I've read stories about some national elected officials receiving the vaccine. In my case personally, and in others, will take the vaccine when we take it as part of a general population. In my case, given my age and my relative health, I would get it somewhat later in the process than other people who need it more urgently than I do, and I'm perfectly happy to take it whenever it's appropriate for me to take it. But the bottom line is there are people out there who will try to part you from your resources, to tell you that they can do something for you. Be very suspicious and don't respond to those kinds of things. The expectation is the vaccine is going to be free when you receive it. There's no cost to do it. There are no sign-up lists in advance for vaccine. You can't pay to get your vaccine earlier. Medicare and Social Security will not be calling you about getting your vaccine. Many times scammers act as if they're calling from a government agency. You do not need to give out your Social Security number, your credit card, or your bank information before you are able to get the vaccine. Those are tried efforts made by scammers to get critical information on you so that they can seize your assets. Do not give out your Social Security number, credit card, bank information. That is not tied in at all to your ability to receive the vaccine. And if you want to talk to one of the people from our operation, Westchester Consumer Protection is reached at 995-2155. You can also email conpro, C-O-N-P-R-O, at westchestergov.com if you have a question or a concern. If we do have any information that you gleaned from the solicitation, we will certainly pursue it. We'll pursue it within civil authority and then also criminal authority, depending on the nature of who is perpetrating the scam. But keep in mind that whenever something happens, the unscrupulous are out there, and they're always trying to take advantage of it. And I'm very happy that Jim and his team are on the lookout to try to avoid those types of situations. So this is a relatively brief update. Obviously, this is a bit slow week between the Christmas holiday and New Year's. We want to wish everybody a joyous Kwanzaa, which is being celebrated during these days. I believe this is now going to be the third night of Kwanzaa. We've had celebrations of Hanukkah and Christmas already, and of course the secular New Year's event is coming up just in a few nights. Although everything is different this year because of the virus outbreak and most everything is virtual, Do everything you can to avoid unnecessary public contact and take all the precautions that we've long since talked about with mask wearing and hand washing or hand sanitization, social distancing when you are with other people. We are expecting to do our next update this Thursday, which is New Year's Eve day, and we'll do it live. So I'll be present with you in person as well as by voice, by phone, and we'll hopefully have some additional information. We are checking the decisions that are coming out of the governor's office as he uses his executive authority. He's made no changes to the zone designations of yellow, orange, or red zone. No red zones in Westchester. One orange zone in Portchester, and then 5 other yellow zones. There have been no changes in the zone status. All of our schools are on a hiatus during this period of time, so there's no direct interaction about testing with schools. But a lot of concerns about restaurants that are closed because keeping them available outdoors at this time of the year is pretty much impossible. So where we have restrictions on restaurants to only outdoor dining, it's functionally shutting the restaurants down. We don't have that on a widespread basis, but it does exist, and we are trying to work through it. So I'm going to turn once again to our terrific Director of Communications, Catherine Chaffee, to see if there are any other media questions that are out there that we can do our best to answer. Catherine?
Yes, we have 2 questions from David Proper from the Journal News. The first one relates to what you were just speaking on. Portchester restaurant owners want indoor dining to reopen in the orange zone. While the decision falls on the state, do you think these restrictions should remain?
Well, I think the governor has previously adjusted the restrictions in yellow zones and orange zones. These are creations within his authority, and he can modify them as he sees fit. He did so already with schools. If you recall, David, in the original announcement of yellow zone, orange zone, red zone, in the orange zone status, all schools were closed, and red zone status was the same. They changed the protocol to allow schools in orange and red zone districts to remain open, but it changed the testing requirement, and the testing requirement jumped up. But that change made it possible for the schools to open or stay, hybrid open. So I think that same capacity exists in terms of the orange zone designation. I personally have advocated alongside of our state legislators, particularly Shelley Mayer and Steve Otis, Governor Steve Otis, State Senator Shelley Mayer, who've been very articulate, members of the Portchester Village government led by the Mayor, Fritz Valenka, Nancy Barr, the county legislator for the area, myself. We've all advocated for a change in protocol to allow opening of the restaurants at some, level of capacity and some level of testing. Certainly we would expect everybody walking into one of the restaurants to have a temperature check and, splash guard, plastic covered, plexiglass dividers between places so that people could eat with the minimum likelihood of spread. But we do think that the restaurants of Portchester should be allowed to have an open. We've made that advocacy, and we hope that we can continue to be persuasive and have the right changes come to pass.
Okay, and the next question, and this is actually the final question, also from David Proper. He asks, what progress, if any, has been made in the orange zone?
Well, it's I don't have the statistics of Portchester specifically as to how they've done over the last week, 2 weeks. The governor's also sort of readjusted his thinking so that it isn't just percentage of infection, it's percentage of available hospital beds as may be needed for hospitalizations. And in that regard, every geography in Westchester relies on the 11 main hospitals of Westchester. And I might add, Greenwich Hospital, which obviously is over in Connecticut, is by all accounts the local hospital for people who live in Portchester, Rye City, Harrison, Rye Brook. It's the nearest, most connected hospital to that region of Westchester County. So with all of those hospital beds available, the governor has not expanded zones based on the infection numbers because some of the infection numbers have gone up in different places. To that extent, I think what we're looking at right now as we go forward is whether or not the hospital availability, the hospital bed availability will be sufficient for the state to proclaim that the zone structure is different and maybe yellow zone cautionary is sufficient and you don't need orange zone restrictions or certainly red zone restrictions. All of the data, though, I've talked about this in light of the dashboard, but all of the data that's at the fingertips of the state, if they're not at the fingertips of the county, we're not in a position to know what they know. And obviously, we'd be guessing with a minimum of information. But I do think that if the focus is toward available hospital beds, Westchester at this stage of the game has been able to do that. And as I've done where I've had discretion in our parks and recreation, I look for a balanced strategy to open things that can be opened safely and close those things that just can't be opened safely, rather than make everything a universal opening or a universal closing. And I hope that moderate, middle of the road sort of attitude is the pragmatic attitude that will prevail, because I think we're all facing pandemic frustration. We all know that the society is not structured around, a long-term extension like this. It's going to be hard to get compliance from people in a second full year of this. So I think a practical attitude toward these things, if the metric now is hospitalizations, let that be the metric, and create the protocols that will allow for dining and other activities safely, as long as we know that we've got the hospital beds and the professional personnel to handle the outbreak if it spikes up well beyond what we have now. But all of those things are within the power of the governor and the state, and we look to influence it as best as we can with logic and reason, and try to implement all of the regulations that come down, which have the force of law. So with that, if there are no more questions, we'll thank you for tuning in for this updated session. We will be back again at our normal 2 o'clock hour on Thursday. And if we have some other updated information between now and then, we'll certainly burst into your day and provide it to you. We are monitoring not just the state tracker and keeping an eye on our own tracker, but we're looking at actions that the governor may take if there are executive orders or anything that we think warrants us visiting with you before we get to Thursday. We will do that. But absent that, again, George Kwanzaa, get ready for a Happy New Year, and we'll see you on Thursday. This is George Latimer, Westchester County Executive. Thanks again. Stay safe.